number already, but there's still a lot of work to do.
I totally agree with that point. I think it's better for medical physicians to start using practical stuff, ultrasounds, echoes, instead of wasting their time learning about plants, zoology, and other like basic medical science that will not help you during your medical practice. Okay, to be honest, this is a frank point. I waste my time learning this stuff. Then when I go to real clinical for practice, I find the doctor is a kind of a supervisor. Okay, do this, do that. Instead, the doctor he's the person should be doing stuff. Okay, I think yes, it will need a lot of change, and I think the best stage for that is that during the internship and they start the residency. That's the very best. Instead of starting straight away, you should train them like 1 week for some medical instrumentations or whatever, like an introduction, before they start their residency, and it should be implemented in the residency program. That is the best. Was my opinion.
You asked a very biased group on that question. Of course, you're going to get yeses.
I think the future will be an anesthetist or a doctor, instead of carrying a stethoscope around his neck, the future will be a portable echo ultrasound in his pocket. And I think mobile phones, smartphones, I think that's the future. I mean, I learned doing central lines using landmarks, but that's became a history now. And I think medical school probably should integrate those systems now. They are becoming basic tools with all specialties are using it. It's not really, we used to think cardiologists are the ones only do echo, where now actually everybody should be really able to do it, maybe, in the future anyway. Thanks.
Actually, some doctors, they don't use their stethoscope. Okay, so and you start them to use the ultrasound probe.
Anyway, I must compliment the organizers of this conference, because it is not common to have so much space about ultrasound in anesthesia conferences in the world. So this will change in the future. What we are trying to obtain is to include, by doing research, of course, and getting very, very good results, and with a lot of data, is to be included, ultrasound use, I mean, in the main societal guidelines. That is the next step. Then, once we will be included in the societal guidelines, everything will come, everything, of course. But the first step, in my opinion, at this stage, is to work to obtain data, demonstration, and to be then included in the societal guideline. That is a very hard work, and not because it is difficult to obtain data, because it is very difficult to change the mind of people. This is very difficult, I find. We have, for example, speaking about chest X-ray and lung ultrasound. For example, for instance, in pneumothorax, we have a lot of data about the usefulness of lung ultrasound in pneumothorax now, because we have many studies published. But still, there is a resistance considering lung ultrasound useful for pneumothorax. Why? Because there is chest X-ray. But if you go to look how many data have been collected about chest X-ray in pneumothorax, I tell you that there are 0 studies. So it is a convention, and it is very difficult to break this convention, but it will happen in the future.
Any further questions? No? Okay, I think we'll close the session for now, and would like to, Dr. Allison, I think, is having a flight to catch.
Yes. Thank you very much for, again, another interesting and excellent session. We really enjoyed that. And Dr. Michael Allison is actually going to leave us early today. So, again, thank you very much for all your brilliant lectures. We really enjoyed it, and enjoyed the ultrasound and echocardiography workshop that you were helping us with as well. So that was very good feedback from it as well. So we really appreciate your presence here with us, and thank you very much for everything.
Thank you so much.
Thank you. So just an announcement, we're going to start sharp at 1:30, so you're having about a couple of hours break. Lunch will be at around 12:30. So, but starting sharp at 1:30, please, for the next session. Thank you very much.